that's actually what we're doing today. I'm especially excited to introduce you to our expert guest speaker today, Dr. Kezia Scales from PHI. Kezia is the Vice President of Research and Evaluation at PHI. And for those of you that are not familiar with PHI, they really are at the forefront of leadership on nearly every state and national initiative to improve, expand, support, and advocate for the direct care workforce and the people that they serve. Kezia leads PHI's strategy for building the evidence base on state and national policies and workforce interventions that improve direct care jobs. And she's been published numerous times in academic journals, and she's regularly disseminates her research findings and policy recommendations and best practices at countless speaking engagements. And I want to take note here too that she even took time from her incredibly busy schedule to serve on ARCH's expert work group to develop the core competencies for respite professionals that became the basis for the respite provider recruitment and training initiative that we've been partnering on with the National Academy for State Health Policy and the Respite Care Association of Wisconsin with support from ACL that you all have heard so much about, but we'll probably hear more about that in our breakout groups today too. Her participation in the work group was really key to elevating that work and lending true legitimacy to the product. So we're very grateful to her for that. And she's here today to share what she knows about best practices and state policies to strengthen the direct care workforce that I'm sure will most definitely inform the work that we all do going forward. So thank you so much for being here, Kezia, and I turn the floor over to you.
Thank you so much. Thank you, Jill, for that warm introduction. And thank you for the invitation and the opportunity to meet with all of you this afternoon and talk about state policies to strengthen the direct care workforce. It's really an honor and a privilege. I'm very happy to be here. Jill is going to be driving my slides for me, so I'll be giving a few prompts along the way, but if you'd go to the next slide, thank you. So as Jill said, PHI is a national New York-based nonprofit organization that's dedicated to promoting quality direct care jobs as the foundation of quality care for older adults and people with disabilities across settings, primarily long-term care and post-acute care settings. And we really try to take a 360-degree view of that work. So we address job quality through workforce interventions on the ground with employers across settings. We also do research, policy advocacy, and public education efforts, all aimed at really trying to enact the sort of systems level and structural changes that we need going forward. So if you'd go to the next slide, please. I want to start my brief presentation to you all today on state policy strategies regarding the direct care workforce with 3 key facts about why these policies matter. And it's not that I think any of you need any convincing about that, but I think that sometimes it can be helpful to understand what's happening in your work and in your state in the context of what's happening nationwide. So the first fact is that we are talking about a huge workforce when we talk about the direct care workforce. This workforce is at least 4.7 million and likely more personal care aides, home health aides, and nursing assistants, as formally classified, who are employed across settings of care, but primarily in home and community-based long-term care settings. So according to our analysis at PHI, slightly more than half of this entire workforce nationally works in home care, and about 14% are in residential care settings like assisted living, about 10% are CNAs in nursing homes, and the remaining 20% are employed across other settings, including hospitals. At 4.7 million workers, this is a larger occupational group than any other single occupation in our country. So the next largest occupational group for comparison is retail salespeople. Now, respite care providers in particular are represented in this figure to some extent, but probably not entirely so, because this number, as large as it is, does not adequately adequately account for those who are employed directly by individuals or households using private funds, or even in some cases using public funds. And that group, that sort of undercounted group, likely includes a significant proportion of respite care providers. So on the next slide is the second and closely related fact, which is that this workforce, already so large, is growing rapidly to meet escalating demand. So what this slide shows is that within the next decade, from 2021 to 2031, the direct care workforce is expected to add nearly 1 million new jobs. That's new jobs that will need to be filled to meet demand. And as you can see here, that's more new jobs than the next 2 occupations with the most expected job growth combined. So it's not necessarily that we will have the people to fill these jobs. That's just the number of jobs that we will need to maintain the same level of services that are currently being offered, but for an ever larger population of older adults and people with disabilities. And the third key fact on the next slide, and I think this is probably one that you're aware of possibly most acutely, is that we are struggling right now to recruit and retain enough direct care workers right now, notwithstanding the need to recruit more workers in the years ahead. And that challenge, that recruitment and retention challenge, is due to a combination of factors that mostly stem from poor job quality for direct care workers. So as we all know, these are persistently underpaid jobs with limited benefits, inadequate training in many cases, limited, if any, opportunities for career advancement, often inadequate supervision, and overall, a lack of sufficient respect and recognition. This is sort of what we're talking about, the systems level, in terms of how direct care workers are valued and compensated. And what's here on the screen is just one indicator of these challenges. So in our research at PHI, what we did is we looked at median wages for direct care workers in every state. And then we compared those median wages to median wages for all of the other competitive occupations, meaning other occupations with similar entry-level requirements related to training, skills, and experience. So we're talking about retail jobs, food service jobs, administrative support, roles like that. And we found that median wages for direct care workers were lower than median wages for these other competitive occupations in absolutely every state. And the difference ranged from about $1.50 per hour to almost $5 an hour. So the slide here shows that state by state comparison of how large the difference is between median wages for direct care workers and these other competitive occupations. I highlighted, I'm based in North Carolina, so I highlighted North Carolina there on the slide as one example where that median wage difference is about $2.75 an hour. So that just really illustrates what we're up against in terms of being able to attract people into these jobs and keep them there when wages are sort of undeniably higher in many other competing roles that they might select. So moving to the next slide, those are a few of the key coordinates of the landscape that we're working in here. And I just wanted to say that if you're interested in learning more about the direct care workforce in your state in particular, there are a couple of key resources that you can check out. This first one that you can see here is PHI's Direct Care Workforce Data Center. And there, what you're able to do is look at a range of data indicators or variables nationwide, or you can select your own state and look at those variables for your own state. So you can look at demographic profile of the workforce. You can look at workforce projections, wage and poverty and public assistance statistics and things like that. And those can be disaggregated by home care workers versus those in other settings as well. That kind of data we find can be really helpful for developing or advocating for certain types of workforce policies and practices. And then the second resource, if you just give a click, Jill, is PHI's Direct Care Workforce State Index. This is a newer resource that PHI has developed, and what it does is it describes and ranks every state according to a range of public policies pertaining to direct care workers and direct care workforce outcomes. I will say from the outset that this is not a perfect measure. It does not capture everything that is happening in a given state around the workforce, but by providing key data that's comparable across all of the states, it enables some cross-state comparison, and it also helps identify where the opportunities may be for change in any given state. And then it all sort of rolls up into this highest level ranking across all the states about how they're doing on their direct care workforce policy and outcomes. Okay, so on the next slide, what I would like to do now, as requested and promised, is to talk through some state policy strategies. I actually, though, want to start with a couple of disclaimers. The first is that what I'm going to share in the next few minutes are really pretty high-level suggestions, and they are somewhat Medicaid-centric. They're more so focused on Medicaid because Medicaid, being the primary payer for the direct care workforce overall across states, does offer the most levers for change in our work in this field more broadly. So because these suggestions are somewhat high level, and because they are more focused on Medicaid than not, the content may or may not be directly relevant to your work in building statewide respite systems and the workforce. But what I'm really hoping is that the content can be at least somewhat helpful as the jumping off point for what I know will be really much more in-depth and rich discussions in the breakout sessions after I stop talking. So with those disclaimers and with that hope, I'm going to talk through 8 state policy solutions, drawing from this publication that you can see here on the slide that we produced last year, which is based on PHI's years of experience in the field and our research around policy strategies and solutions. The report itself has a whole range of strategies. I think there's about 27 different distinct strategies, and each one of them has a state example to kind of illustrate it. So I'm going to only give a sort of sampling of that, and I encourage you to check out the full report if you're interested in learning more. On the next slide, actually, before I present the first policy strategy, this is probably absolutely unnecessary because you're probably closely familiar with both of these reports, but I did just want to make sure, absolutely sure, that you were aware of these 2 reports from the National Academy for State Health Policy, which speak directly to this topic. So the first one here is the direct care workforce section of the RAISE Act state policy roadmap. And it has a lot of really tangible and practical guidance and strategies. And then the second is, if you give another click, is this very recent report on respite care strategies in Medicaid waiver programs. And I think that's really important for helping to think about what it means to have a coordinated network of services across states. Okay, great. So I'm going to go through each of those state policy solutions, those 8 solutions, highlighting one specific strategy that I hope might have the most relevance to your work. This first one, if you go to the next slide, Jill, is perhaps the most ambitious. This is the need to reform long-term care financing so that we actually pay for the level of services we need, including respite care, among other services. So if you go to the next slide, this is fundamental, right? Financing, long-term care financing is fundamental, but also feels totally out of reach in many cases in terms of what we can actually impact. But I do just want to highlight one example from Wisconsin of an effort, a sort of more targeted effort to infuse a little bit more funding into the system to specifically strengthen the workforce. So during the pandemic, with funds from the American Rescue Plan Act of 2021, Wisconsin introduced across the board rate increases for long-term care providers, but also allocated this pot of funding, separate pot of funding to long-term care providers, including respite providers, that was specifically for increasing wages or covering other compensation related expenses, like bonuses or shift differentials, paid time off, things like that, and associated sort of administrative costs. These funds are allocated to providers on a percentage basis through the managed care system, and the impact is evaluated through an annual survey. My recommendation in highlighting this example is really just to be aware of this type of initiative and making sure that respite providers are benefiting to the extent possible. But also there's room to advocate for this kind of approach in other states, because it's a really good way of targeting funds where they are arguably needed the most right now, which is on stabilizing the workforce. Okay, the second, again, pretty high level, pretty grand solution on the next slide is to increase compensation for direct care workers, very related to that previous solution. So states are trying to address low wages for direct care workers through Medicaid in a few different ways. Not every state, of course, but a number of states, recognizing that this is such an important pain point in this whole situation. So a couple of strategies, the most prominent strategies, are to enact wage pass-through policies, whereby a certain percentage or dollar amount of base payment rates or enhanced payment rates go through to workers' wages, or by establishing wage floors, so minimum wages for these workers. And here on the next slide, rather than giving us a specific state example of what states are doing, I wanted to direct you to this recent report from the National Governors Association, if you haven't seen it already, because it really nicely lays out these different types of wage strategies and which states are doing what. Of course, again, this is mainly about what is happening through Medicaid and through Medicaid reimbursement rates to address wages. But I hope there are some transferable lessons learned there. As just one example, I know a AAA, which increased rates for the providers in its network that agreed to meet a wage floor for the workers that they employed with those funds. So there are ways to kind of think about these in other funding streams. But possibly, I think the critical takeaway point here is that it's important for all of us to know what's happening in Medicaid kind of across the board with regards to workforce policy, but here specifically around wage rates. And also to have a sense of what's happening with wages in these other competitive industries that direct care workers might choose to go to instead, in order to be able to do whatever is possible to kind of stay in the game, to be able to match those rates, to have commensurate opportunities for workers within respite care programs in particular. And so on. And I absolutely know that is all contingent on available funds and other factors. So I'm offering that takeaway with a big grain of salt, but just something to be thinking about. On the next slide is the third solution, which is to strengthen training standards and delivery systems for direct care workers. Because another challenging factor in our field is that training for direct care workers is so piecemeal and patchwork, and sometimes it's duplicative, and sometimes there are great gaps in who's getting trained in what and who's not. And all of that can undermine the preparedness of this workforce to provide quality services, and it can compromise their ability or their likelihood to stay in this field, to build a career in this work. And so this solution here speaks to that well-trained component of the national strategy around the workforce, that agile, flexible, and well-trained workforce. So on the next slide, I would say that the good news here is that a number of states are proactively taking steps to try to build a more coherent, streamlined, competency-based set of training standards and delivery systems for direct care workers. And in the best cases, these come with recognized portable credentials for direct care workers and career pathway opportunities. So one fairly well-established example that I wanted to highlight here is Washington State's home care aide training and certification program. At the core of this program is a 75-hour caregiving curriculum that prepares trainees to work in a range of direct care settings. There are, within the sort of set of standards, there are streamlined options for family caregivers who are paid with public funds, and there's an abridged version of the training for respite workers in particular. The credentials that come through this program are recognized statewide, and there are also opportunities to bridge from those credentials to other positions like certified nursing assistant. The important point here that I want to underscore is that when we're thinking about just the importance of thinking workforce-wide about recruitment and retention efforts, and training, adequate portable training being one part of those efforts. Because by doing so, we're more able to strengthen and stabilize the workforce overall, so that then we can deploy people as and where they're needed. And the converse of that is that the more we're sort of working in silos and the more barriers and gaps there are between services and standards and different approaches and different efforts, the more we end up sort of trying to pull workers all from the same labor pool, but pulling them in different directions and sort of competing over them, and then maybe losing them altogether. So much of what I'm saying here, I feel like I'm speaking to the experts in the field. You know these things already, but really just trying to highlight some of the examples and practice of how states are trying to address these challenges. Okay, so on the next slide, the fourth solution is to fund, implement, and evaluate direct care workforce interventions. The point here is that we need all hands on deck. We need as much innovation as possible to address these entrenched workforce challenges. And we need to fund and support and evaluate that innovation so that we're able to learn more about what works, what should be replicated, and maybe what doesn't, what we could sort of let go, what we could stop doing because maybe it isn't effective or is no longer effective. So moving on to the next slide, this is sort of a catch-all category, but the kind of innovation that I wanted to highlight is matching service registries. And these are online registries that help individual consumers or their families connect with workers to fill their service needs. And that can include respite workers, respite hours, and vice versa, helps workers find consumers. So these platforms can play a really important role in helping individuals get the support they need, but also helping workers to piece together the schedules and the caseloads that they need. So there are a handful of statewide, state-sponsored matching service registries out there, but there's so much room for more development and for scale up. The example that I highlighted here on the slide is Minnesota's Direct Support Connect registry. And that's a good example for a couple of reasons. First, it's more broadly available than some of the similar types of registries because it's open to all consumers, regardless of their payment source. So it's not just limited to Medicaid beneficiaries. And it's also sort of multifunctional in that it also links to background checks and educational credentials for workers. So I think it's really helps facilitate quicker and more effective matches. If you would like to learn more about registries, we have a list, we have a page on our website at PHI that lists all of the current registries nationwide. And I'm happy to share a link to that at the end of the presentation. But moving on, the fifth solution is to improve direct care workforce data collection and monitoring. And this is really about how much more data we need on this workforce in order to better assess what's going on, to develop the best strategies, and again, to be able to evaluate what works and what doesn't. So on the next slide, what I wanted to say is that this particular state policy solution or set of solutions may be even more distanced from your remit, even though I think all services and related workforce efforts would benefit from more data. But I did want to include it because there's one strategy that might be helpful to think about, which is to directly survey workers to learn more about their experiences, their challenges, their turnover intentions, what they need in their jobs to succeed, and what would help them stay in this work and in the field. I think that survey research like that on respite care providers in particular could really help inform some targeted strategies and solutions. So here on the screen, I've highlighted an example of a survey that PHI conducted with home care workers in Arizona in partnership with the state's managed long-term care plans, for managed care plans. There's a link there where you can read more about the survey, and you can also link to the actual research report if you're interested. But the main point in highlighting this is that we were able to reach over 4,000 workers across the state with a simple online survey link. And in doing that, we were able to learn so much directly from those who are in these roles, who are doing this work day to day, about where we could focus intervention efforts, where workforce development efforts could potentially be most effective. Okay, so moving right along, the sixth solution on the next slide. And just to say for the record, I realized as I was going back through my slides that I've put these solutions slightly out of order relative to the list on that initial slide. So if you're the kind of person that cross-checks, I acknowledge that error, but I didn't want to change around the slides at the last minute. So I'm going slightly out of order here. But in our presentation today, the sixth solution is to rectify structural gender, racial, and other inequities for direct care workers. Again, this is a very high level solution, but overall it's about thinking about workforce policies and practices with a consistent DEI lens, given that this is a workforce that is overwhelmingly women, people of color, and in many cases, immigrants to the United States as well. So on the next slide, the example that I wanted to provide here is actually more of a practical tool than a state policy strategy, though I think it could be useful on a number of levels. So this Embracing Diversity toolkit that you see on the slide, and there's a link there as well, was developed by the Ontario Centres for Learning, Research and Innovation in Long-Term Care. It specifically, as you can see in the title, pertains to long-term care homes, but there is a lot in there that is transferable to any long-term care setting around organizational culture, training, human resources, and so much more. It's really a very practical and user-friendly toolkit. And so I just wanted to share it with you, and I encourage you to take a look and think about whether it might be useful in your work, really on any level. Okay, so on the next slide, the seventh state policy solution, or the sixth, if you're following the original guide, is to center direct care workers in leadership roles and public policy. The idea here is that direct care workers themselves have for far too long been left out of the conversations that pertain directly to their work and their expertise, both in practice in terms of their exclusion from or marginalization in the interdisciplinary care team, and certainly in policy discussions that impact their work and the services that they deliver. But as I'm presenting it to you all, I would expand this kind of high-level solution even further to include all of those who are directly involved in the planning and provision of services, but are not necessarily included in the bigger picture policy discussions that absolutely shape the context of that work. Aren't necessarily included, but really should be. So on the next slide, I wanted to, in particular, under this large sort of high-level solution, I wanted to pull out the importance of convening state-level task forces and work groups and councils and other interdisciplinary bodies that ideally include all relevant community partners and that can be tasked with looking, again, sort of across silos and across issue areas to generate the most comprehensive workforce solutions possible. So the example I've highlighted here is Maine's Direct Care and Support Professional Advisory Council. This council was convened just last year in 2022, and it's fairly unique among states in that it exclusively comprises members who are in frontline caregiving roles. Appointments to the council are made by an interagency sort of multi-member steering committee. And the remit of the council is to inform policy decisions on issues that are most important to these to the members, these individuals in frontline caregiving roles. And this is sort of in the context of Maine having also convened a long-term care workforce commission to look at issues across the state. And that commission included legislators, agency staff, and a range of other community partners. To my knowledge, there is no centralized list of the types of long-term care or direct care task forces that have been convened across states, though that would be a helpful resource. Back in 2019, PHI did a scan and we reviewed about 16, I think, task forces that had been operational up to that point. And that's another link that I'm happy to share in the chat. But I would really encourage you to look into whether there's such an initiative in your state and opportunities to be involved and to help steer that conversation. And I'm also happy to help dig around a little bit if you're wondering if there's something like that in your state. And then on the next slide is the final high-level solution, which is to shift the public narrative on direct care workers, meaning that we need to improve public understanding and recognition of the value of direct care, including respite care, to boost support for and investment in this workforce, to help drive recruitment into the field, and really so much more. So there are lots of ways to do this, but I just wanted to return to Wisconsin for one specific and tangible example. So on the next slide, I've highlighted Wisconsin's WisCaregivers Careers Program. So Wisconsin has a whole sort of long-term care sector-wide workforce approach that is being brought under the banner of WisCaregivers Careers, which is a program that originally began as a recruitment and retention effort in the state's nursing home sector in particular. So the idea with that program originally was to build a pipeline into CNA jobs, partly by spreading the word about the importance and the value and the rewards of this work, and then coupling that with paid training, guaranteed employment offers, and retention bonuses as well. The part that I wanted to highlight was that spreading the word part. And I've provided on the screen a link to the videos that were produced and widely disseminated as part of that effort. And these videos feature workers themselves talking about their work and why it matters. I think that's just one really compelling example of how to go about spreading the word, changing the narrative on the value of this work. Another effort that I would just signpost you to is PHI's own Direct Care Worker Story Project, which is available on our website. And in that project, we are aiming to elevate the voices and the stories of direct care workers. So we do interviews with direct care workers across settings and across states, and couple those with photo shoots so that we can really help individuals kind of put themselves out there and tell their own story and get a much richer, more nuanced understanding of this work. And again, why it matters. Okay, so on the next slide, I've said a few times about other resources that are available on our website. So I just want to provide you with the link. It's phinational.org. Again, we have the Workforce Data Center, the State Index, the Direct Care Worker Story Project there, and lots of other resources and reports, and also the opportunity to sign up for our newsletter if you're interested in getting monthly highlights about what's going on. And the final slide just includes my name again, my email address, and I absolutely invite and welcome follow-up if you have questions or thoughts or comments after today's presentation. Thank you so much.
Thank you so much, Kezia. That was so rich. Not only with all the amazing resources that PHI has to offer, but all of your best practice states that you cited. I think, you know, they are very high level and they might be Medicaid focused, but I think there's a ton of information there that can really still inform the work that the grantees are doing. Even when you were talking about the registry, the matching registry work, there are a number of our states now that are building respite registries that build on some of the matching registries that we learned about from PHI. So, you know, even on a smaller scale, they may not be comprehensive registries, but it's a way, again, to deal with the respite workforce issue. And I loved how you related the registry work to just building the confidence and competency and availability of providers, and linking them to families can really help build capacity. So that was very helpful. It was just a really great presentation. Thank you so much. We do have one question in the chat, and Sarah, I don't know, are you willing to come off mute and ask it, or would you like me to read it for you? Kezia does have a few minutes for questions, so if you have them, now's the time to unmute. I'll ask the question. Sarah, are you there?
Yep, I'm
here. Good.
Sarah Taves from Idaho. Just curious as to what thoughts are swirling around with the use of artificial intelligence as a tool to help either make connections or streamline. Yeah, I'm very interested in the tool.
That is a great question, Sarah. And I feel like at PHI, we're only starting to grapple with how to think about AI. And as a field, I feel like we're still trying to grapple with how to embrace technology and just sort of, you know, best leverage existing technology. So I love that you're thinking about AI, and I think we have, we're going to have to sort of accelerate our pace a little bit about thinking about technology overall, and then thinking about AI in particular. So I don't know that I have a very good answer on that right now. I just think that we need to really be thinking about how we can leverage all types of technologies to sort of fill in the gaps and sort of automate or mechanize or strengthen some of the processes that surround the actual in-person, person-to-personal relational nature of providing care. And that feels like a huge set of opportunities that we really haven't fully embraced. But I would love it if you have thinking about AI. I would love to hear from you too, or others.
You know, I was just talking with a geriatric psychiatrist last evening, and he was talking about, you know, just thinking about AI and how we could really use it to enhance our assessment processes and gather so much information from so many different sources, and then using that to really identify, well, what type of skill set does, let's say, your direct care worker need to have, or capitalizing on the interest of the direct care workforce and then matching them with the person, the client. That it's just something I think we need to keep at the forefront of. We cannot lose this opportunity to really maximize the technology and recognizing the changing face of the population that may need services, that they're super comfortable with technology. You know, they got it. It's not a scary thing. Yeah, so I'd love to be involved as things unroll there. Yeah.
Thank you. Wonderful.
Excellent question, Sarah. Thank you. We have another question from Jenny in South Carolina, who'd like to know how often is the PHI index information updated?
Great, thanks, Jenny. So the state index tool, we only just launched that this year. So it's sort of in its first iteration, but it draws on sort of range of research efforts and data points that we pulled together. So some of the information in it is a little bit older and some of it is newer. And we're aiming to probably not update that annually, but sort of update it in pieces over time. The other key resource, the Workforce Data Center, that is updated annually. It's actually going through its annual update right now and will be launched in September, using the most recently available data from all of the public data sources that we use. So what is released coming up will be 2022 data for the most part, in some cases 2021 data, depending on the source.
Yeah, that's a very useful tool also. So wonderful to see that developed. Any other questions or comments from anyone? I just want to reiterate one point that you made, Kezia, if that's okay. And that's, if people would like to connect with whoever is leading workforce development in their state and they're not sure of who that might be, that they might be able to contact you and you can help them figure that out. Because some of these initiatives that Kezia was talking about are very big and very broad, and probably not something as a lifespan grantee you can do on your own. But if you can connect to whatever's happening in your state and add the respite voice to that, that would be extremely valuable strategy as well.
Absolutely. And we won't always necessarily know, but we're always happy to help dig and figure things out. So please do reach out.
Tracy, I see you just added something in the chat. Is it anything you want to unmute and talk about, or is it just a comment?
Well, Jill, it's both and, right? It's a both and situation. Thinking about AI and having searchable databases really does empower our folks, and then having AI in a limited basis, mimic a person, right? Because that's really what, chatbots and all those are doing. And again, just there's a very recent, very public national organization that had a helpline that started using AI, and it's an absolute disaster. So I think, all of our learnings, when they're painful and completely, unintentional, I believe the organization did not intend to have this type of learning. And they do have, I think the other place for all of us in this national configuration is the 211s and the 988s, and bringing those together, because all in Washington state, our 211 is doing an amazing job of really doing brokering linkages, but their system can only go so far. I've seen it on the back end from us as an organization, and it's a little bit limited, but on the other side, they will really work to connect people and actually team all the way through. So shifting, hats and being on the Traumatic Brain Injury Council for the state of Washington, the absolute amazing connections that they're doing. If we could also leverage up those linkages, I think we already have some resources out there that are being untapped and not fully utilized. So those are my additional comments to the one in the chat box.
Thank you for sharing that. Well, I know Kezia has to run, and we're again so grateful. She put some wonderful links to resources that she referred to in her talk. They're in the chat. They're also in her PowerPoint presentation and I posted the slides. I'll post them again so you have the link to that. But thank you so much, Kezia. So much food for thought. I can't wait to get into our breakout groups and see where you take us.
Thank you so much. I hope you all have a wonderful conversation from here.
Thank you all. Thank you very much.